when you go into a doctor's office, just right off the bat, but with a new symptom that's not been diagnosed and don't know what it is, there's a 40% chance that you have a neuroplastic symptom, because 40% of people that go to a primary care physician, that's what they have.
Hi there. I imagine that far too many of us have heard things like, it's all in your head, you're just anxious, or probably the worst medical line that we hear of all time is, there's nothing wrong with you. I've done around 125 interviews with people so far who've heard it all, and that's a lot of interviews. But my guest today, the incredible Dr. David Clarke, has done over 7,000. That's 7,000 patients whose symptoms weren't explained by standard medical tests, people that before seeing him were dismissed, they were labeled and left without answers, and sometimes implied or outright stated by other medical professionals that they are just being lazy, or that they're even lying or hysterical, which is just a fancy way of saying, a not so nice way of saying that we don't know what's going on. So clearly the blame must be on you. But here's the thing. None of this is true. These conditions are very real, very serious, and fortunately, very treatable. If you're new here, I'm Raelan Agle, and this is where we break down real recovery stories and talk with experts who are actually helping people get better from conditions like ME/CFS and long COVID. No fluff, no gatekeeping, just what's working. And I am beyond excited to welcome Dr. Clarke joining us over in Portland, Oregon. He is a board-certified physician in gastroenterology and internal medicine, clinical assistant professor of gastroenterology, emeritus, that's a mouthful, at Oregon Health and Science University, and one of the leading voices in neuroplastic symptoms and mind-body medicine. Not only is he the co-founder of ATNS, an organization that's helping thousands recover, and training doctors to finally stop giving people blank stares when they come into their office. He's also on the advisory board of Curable, an app that I talk about incessantly and one of the most mentioned resources in the recovery stories here. Dr. Clarke's book, They Can't Find Anything Wrong, has helped thousands understand why medical tests don't always hold the answers, and what to do about it in those cases. Dr. Clarke has spent decades uncovering the patterns behind these conditions and helping people recover when nothing else was working. Basically, if Unexplained Symptoms were a mystery novel, he would be Sherlock Holmes. Hands down. I know so many of you have been waiting for this interview, and it's one that I've been so excited about that I could barely sleep last night. So let's dive in. Dr. Clarke, what an absolute pleasure and honor to have you here. Thank you so much for doing this today.
My pleasure, Raelan. Great to be with you.
Yeah, I was saying before we hit record, I'm going to resist the urge to make this a 7-hour interview because I have 1,000 questions for you, but we're going to work hard to just keep it really packed full of key stuff.
We're going to put all the good stuff in 40 minutes.
Absolutely. Absolutely. Before we kick into all that good stuff, I know that people would be interested. I know I am very interested to hear, how did you get into this line of work? How did you become so passionate and focused on recovery?
It's actually almost an embarrassing story as a physician that I went through 7 years of formal training without having a clue about anything that we're about to spend 40 minutes talking about. But in the 8th year of my training, and I was very successful up to that point. I was getting great scores on exams. I got an award for excellence in medical school. I got into my dream residency program at Harbor UCLA Medical Center. I thought I was doing really well. The system was telling me I was doing really well. So the last thing I expected was to run into a patient that I didn't know the first thing about diagnosing or treating. And this was a 37-year-old woman who, for the previous 2 years, had been averaging 1 bowel movement per month, despite taking 4 different laxatives at double the recommended doses, and had already been tested thoroughly by another university. And they sent her to us because we did some specialized testing on the electromechanical properties of the large intestine. And my department chair and I knew or thought we knew, that that test was going to be abnormal, because as far as we were concerned, no other explanation was possible for her symptoms. And when that test also was normal, we were just baffled. It was left to me to do her exit interview and basically tell her, I'm sorry, but you're going to have to live with this. But I asked her about stress one more time, and she didn't have any. She was happily married. She had 2 kids. She worked half-time in a bank. No stress going on there. But then I asked her, well, what about stress earlier? Thinking, maybe 2 years before, when her illness had begun, that something had happened. And she interpreted my question to mean the more remote past. And she told me that her father had molested her. And I had never heard that before from a patient. I had no training that one should ever even ask about something like that. I didn't know what to do with it. I thought if I talked to her about this, it might make her worse. It might precipitate a crisis. But, we were at the absolute end with trying to diagnose her condition. So I fell back on basic medical training and just took a history. And it turned out to be one of the worst stories of abuse that I ended up hearing in my whole career. But I had no idea if it could possibly be connected to her condition, her medical condition. The abuse had stopped happening 25 years in the past. But there was a psychiatrist at UCLA that had an interest in these kinds of issues. And so I was glad to have a place where I could send this patient, and got an appointment with Harriet Kaplan, the psychiatrist. Forgot all about her for 3 months until I ran into Harriet in an elevator. And this was the elevator ride that changed my career, because between the ground floor and the 5th floor, Harriet told me she had cured this patient with about 10 weeks of counseling sessions, 1 hour a week. And that just blew my mind. The idea that you could alleviate a serious physical condition in the body, real condition, just by talking to somebody. I had no idea that that was even possible. But it had happened. And so I thought, okay, if I'm going to be a complete doctor, I need to learn a little bit about this, because I might see a patient or 2 every year that has these issues. And Harriet gave me her framework for how she thinks about this. And when I went into private practice, I used it whenever a patient had no disease or injury to explain their symptoms. And I thought it was going to be a couple of patients a year. It turned into 5 or 6 a week. And when I sent them off to see a mental health professional, they got cognitive behavioral therapy, which doesn't work very well for this condition. And many of those patients came back and said, I've still got my symptoms. Now what do I do? And I tried to help them because there was no other option for them. And I was a beginner for, a number of years, but like anything else, the more you do it, the better you get. And after 5 or 6 years, I had pretty well climbed the learning curve. I was getting very good outcomes for people that otherwise were not getting anywhere in the healthcare system. And right about that time, I was working for a big HMO, and they voted me their Doctor of the Year. So then I knew I was really onto something. And today we're 7,000 patients later.
Oh, I don't even know where to start with that one. But maybe a good starting place is, you talk about this as, psychophysiologic disorders.
Well, our new name is neuroplastic symptoms. So we think that's more hopeful. Neuro for brain and nervous system, but plastic means capacity for change in medical jargon. And there's a lot of hope in that term.
Okay, that is a much easier term to say. It can be confusing because there are a lot of different terms out there going around that are generally speaking to similar things. Sometimes I hear it called functional disorders or mind-body conditions, or I'm forgetting the rest of the list.
There's a dozen, yeah.
Yeah. So when we talk about neuroplastic symptoms and conditions, what does that mean?
It means that the brain is creating pain or illness in the body in the absence of any physical abnormality. No disease, no injury, just the brain creating symptoms. And all of us have had at least a little experience with this. If you blush with embarrassment, your face turns red. That's a brain to body reaction. If you're in a tense situation and you feel a knot in your abdomen or butterflies in the stomach, that's a brain to body reaction. Or another example is phantom limb pain. Somebody's had an amputation and they feel pain where the limb used to be. Obviously, it's not coming from your arm or leg. It's also being generated by the brain. So that's what neuroplastic means. It's a brain to body condition, but the symptoms are every bit as real as those caused by organ diseases or structural damage.
Yeah, because our experience of the symptoms does not change regardless of the origin. They are just as real regardless of the cause.
Yeah, they absolutely are. And it is difficult for people to believe just how ill you can get from this. One of my colleagues sent me a magazine article by two women who were researchers in healthcare who were also suffering from chronic fatigue syndrome. And one of the comments that they made was, these cannot be mental symptoms. They are too severe. And that just simply isn't true. One of my patients I was first asked to see on her 70th day in the hospital. This was a 17-year-old girl. She was getting morphine in massive doses around the clock for unexplained abdominal pain that had been going on for 18 months. I was the gastrointestinal consultant number 7 on her case from 3 different institutions. You're never going to convince a patient like that that her symptoms are not real.
And I think a helpful thing is to understand how symptoms are created, because we tend to think if my arm hurts, there's something in my arm causing that pain. Or if I get a flu and I get a fever, that flu is making me hot somehow in my body. So could you talk a little bit about how and why symptoms do happen in our body in the first place?
Yeah, let's say that you whack your thumb with a hammer and you've caused tissue damage in your thumb, and that the signal from that damage goes up to your brain, and your brain is going to decide, am I going to give you a pain signal in the thumb or not? Because all pain is actually created in the brain, and the brain is actually deciding whether it's going to give you that signal or not. Now, if you've whacked your thumb with a hammer, it's absolutely going to tell you that your thumb hurts so that you'll take care of it. That's what it is. It's a signal that this part of your body is in danger and that you need to be watchful about it. But in another circumstance, let's say that you are running from a predator and you sprain your ankle. Then in that case, your brain is probably not going to give you a pain signal until you have reached safety. So it's an example of making a decision. Another example that my colleagues love to share was a photograph that was printed in the British Medical Journal about 30 years ago of a construction worker who impaled his boot on a nail. And he was instantly in agonizing pain. Given morphine in the emergency room, they carefully cut his boot away, only to find that the nail had passed neatly between his toes and did not cause even a scratch. So as soon as he saw that, of course, the pain went away instantly. But it's an example of how our brain can create sensations in the body.
And it gets easier to understand these instances where you whack your thumb with a hammer, pain signals are created, or there's a misinterpretation, a miscommunication between the body and the brain. You see the nail in your foot, the brain assumes injury and alerts you to that. But there are many different things that can cause these symptoms to be created. Like I know you speak about ACEs. So can you tell us what is that and why are they a cause for some people to get these neuroplastic symptoms?
Yeah. ACEs are adverse childhood experiences, and they are pretty much anything that you would not want to have happen to a child of your own, or that would make you feel sad or angry if you watched a child you care about going through the same experience as you did. So there's quite a broad range of these experiences, and they can be what some people call big T trauma, like my patient who was sexually abused, but they also can be not so obvious traumas. One of my patients told me that, and this was after quite a conversation before he recalled this, that he only got praise from his parents when he did something better than his brothers and sisters could do it. And he had 3 very accomplished siblings. It wasn't easy to do anything better than they could. So he grew up really feeling worthless most of the time. And that played out into all kinds of consequences we can talk about later that are highly stressful. And that stress can manifest physically in the body with symptoms literally from head to toe. It can be chronic fatigue, it can be long COVID, it can be migraines, ringing in the ears, visual disturbances, pseudo seizures, trouble swallowing, fibromyalgia, irritable bowel, chronic cough, certain kinds of breathing difficulties, abdominal pain, pelvic pain, genital pain, pain in the spine is a big one, obviously. The only common denominator in these stress-related symptoms is that there can be more than one at a time. My personal record patient had 27 simultaneously, and they can go on for decades.
So these things can happen in childhood, but the symptoms might not start until adulthood. So what's happening there?
Okay, well, that can be a complex process, but yeah, that very first patient was a great example. The sexual abuse that she suffered stopped when she was 12. Her physical symptoms didn't begin until she was 35. What in the world was going on there? And there's a lot of complexity and ramifications to this that we can talk about, but in her case, she was gradually healing and recovering from the adversity that she suffered as a girl. And by the time she got into her mid 30s, she had reached a point where she was ready to have the emotions around that experience become expressed. But children who grow up in adverse environments get very good at repressing those emotions. So even though the emotions are kind of starting to knock on the door, the person has got tremendous skills at keeping them locked up. So they need to express themselves somehow, some way, and they do it via the body. And in her case, pretty much shut her bowels down. Oftentimes, one of the indicators that a person is ready to start dealing with these emotions is when their self-esteem has grown to a reasonable level. One of the common denominators of people who've gone through ACEs is that it makes them feel like second-rate human beings in one way or another, or in some cases just never measuring up, or in more severe cases completely worthless. And it takes a long time for people to gradually recover a sense of themselves that matches who they really are. In other words, feeling reasonably good about themselves. But once you do that, you can't escape the idea that you did not deserve to be mistreated in the way that you were. You did not deserve to have to go through the adversity that you did. And the more you feel that injustice, the resentment starts to boil up. And the indicator that her self-esteem had reached a good level was that she had worked for a toxic boss for a decade in a different bank than the one she was in when I met her. And her self-esteem was so poor that she just put up with this guy for 10 years until finally she realized one day, you know what? I'm actually a pretty good person. I do not deserve to be mistreated by this guy. And she quit. And, she had a very transportable skill set. She got another job, very similar, half a mile down the road in a place that was very supportive and kind to her. And that was the point when her bowels started to shut down, because she was in an environment that was reinforcing her self-esteem, and the emotions then were ready to be dealt with. And she just had to be helped to connect with them by Dr. Kaplan.
Something else I know that experts in the field that I've interviewed have talked about and read in many books is that also, because we talk about symptoms happening in an absence of any pathology or structural abnormalities, so this is why we're calling them neuroplastic. But then we also say those structural abnormalities are a really poor predictor of the level of physical symptoms that you're having. Like the correlation between the severity of one and the severity of the other are not the same. Like you can have a scan that shows that your back has all sorts of stuff going on, but you have no pain. But then you'll scan someone else who's showing little to nothing, but yet they're in a ton of pain. So I guess my question is that how do people know? How does one begin to determine if this is neuroplastic pain and if brain retraining programs and nervous system regulation is the route that they should be going when it's such a challenging thing to assess.
Yeah, it can be challenging. The spine is the classic example because we know from taking x-rays or MRIs of the spine that many people who have no symptoms whatsoever have abnormalities in the spine. In fact, a majority of people over the age of 40, just from the normal aging process, will have abnormalities in the spine. And one of the people you interviewed recently, Dr. Schubiner, led a study of over 200 people that had back pain that were evaluated for whether it was structural or not. And it turned out that in 88% of those patients, it was not structural. It was actually neuroplastic. And how do we tell that? Well, the big clue is whether there's evidence of nerve damage. Have you lost reflexes? Do you have numbness of your skin in an area that corresponds exactly to one particular nerve that's getting pinched? Do you have muscle weakness that corresponds to a particular nerve getting pinched? Or do you have bowel or bladder problems from those nerves getting pinched? And if you don't have any of those things, then it's likely that you've got a neuroplastic pain. But it can be a challenge for physicians to sort this out. It happened in my specialty of gastroenterology and people with gallstones. They would have pain in the upper right corner of the abdomen, and they would have gallstones, and the surgeon would take the gallstones out. But there's particular characteristics of gallstone attack pain, and many of the patients didn't have those characteristics. So when their gallbladders were removed, the pain was not helped, and they continued to have it. So it's a challenge for us as physicians to sort this out sometimes. But when we're not sure, we can do an assessment for sources of stress in a person's life. We can also look at the characteristics of the symptoms. Do they come and go in ways that are not what we would expect for a physical cause for the symptoms? Do they move from place to place? That's another one. Tumors and infections and inflammation typically are going to stay in one spot. But if you've got symptoms that move around, or that or one symptom goes away only to be replaced by a new one somewhere else, that's a key indicator of neuroplastic. So those are the kinds of clues we look for. And if we can't tell, let's identify the sources of stress in a person's life. Let's address those, let's treat those, and see if people improve. Because if you've got, tumor or inflammation or fracture or something like that, we can treat your stress all day long. It's not going to help.
So in the cases where you do strongly suspect or know that these symptoms are neuroplastic in nature, then what?
All right, then I'm going to try to assess the person for what kinds of stresses they have in their life, past or present. And starting with, today, what kinds of stresses do you have going on right now? One of my patients, and he'd been ill for months, and none of his doctors found this out. The only time he was having his pain was when he was driving to work. When he was driving home from work, he was fine. So it was pretty obvious, getting that history, that the workplace was his source of stress. And indeed, he had a very high stress job that had become high stress right at the same time his symptoms began. And once he saw that connection, his symptoms were much better just from that. But he was also able to go to his supervisor and get some issues addressed, which really helped a lot. So another one that's very common in terms of stress in your life at the moment are people who are always taking care of everybody else in their world, whether it's their family or their workplace or organizations they belong to. They are continually focused on everybody else's needs, and they never seem to put themselves on the list of people they take care of. And so they're living as if they're on a treadmill. They never step off. And sooner or later, your body is going to protest if you're trying to do that. The next area I get into is to make sure that person doesn't have depression, anxiety, or post-traumatic stress, because those can manifest physically in many people even more than they manifest in mental health issues. The trauma is a big one. So many of my patients had been through a trauma and nobody ever asked them. And they didn't themselves think it was connected, so they never mentioned it. A colleague of mine told me a story about a patient who'd been going from doctor to doctor for months trying to get a diagnosis. And he was the one who found out that right before she became ill, she had been a hostage during the robbery of a store. She spent 40 minutes with a pistol aimed at her neck. That happened right before her symptoms began. But then the biggest and usually the most complex area that I ask about is, were you under stress as a child? Did anything happen to you as a child you would never want for a child of your own? Because many people, when they look back, they'll tell me, oh, it wasn't that bad. Or, my parents cared about me. I didn't really go through anything. Or other people have been through worse. Or I think I'm over it now. But in fact, as I talk to them and learn more and more about it, it turns out it was much more stressful than they appreciate. And another way to tell is, did they have long-term consequences? So we're getting into a long answer here, but personality traits, triggers, and repressed emotions are the three big long-term impacts of adverse childhood experiences. And the more of those people have, the more likely their childhood had a bigger impact than they think.
So it sounds like the core component of the approach to treating these is getting at the core of why they were happening in the first place. And from the people I interview, I think it's an important call out that it seems you don't have to fix everything. You don't have to completely change your life. You don't have to have 100% resolved all your past trauma. You don't have to be a Buddha on a mountaintop living in a bubble of perfection and peace for your symptoms to go away. It's just doing what you can to get at the root of why they came on in the first place. And then even just the education of understanding why the symptoms are being caused can help to alleviate those. Because I think it can be intimidating for people thinking like, I have to fix all my problems and my head has to be a perfect place of peace for me to feel well. And that's, at least in the people I interview, that's definitely not the case. You do your best, but no one's getting perfection there.
No, we want to step away from perfection because that's one of the long-term impacts of going through adversity as a child. Kids try to be perfect so that that's one of their strategies for bringing the stress level in their household down. And they can become, very perfectionistic in that environment and highly self-critical of themselves and contributes a lot to stress. But no, the recovery from this, the example of pain reprocessing therapy is simply to shift attention from whatever's going on in your body to, noticing that as a sensation, but then shifting attention to your mind and thinking about, well, this symptom is my mind trying to communicate with me. It's trying to tell me that it's under some kind of distress. And can I think about what that distress might be coming from? And even just that shift from focusing on your body and fearing what's going on in your body to thinking about it as just a source of communication and thinking about what the meaning of that communication might be, that's huge for people. The Boulder back pain study had a 75% decrease in back pain in the subjects who were treated this way. And they had been having pain for an average of a decade before that. And they get 8 sessions of what I now call neuroplastic psychology, 75% decrease in pain in 1 month, and it was sustained for a year. This was in 50 subjects. So those people did not get, deep into the long-term impact of ACEs. The reason that I focus on that is that I tend to get the most complex and severely afflicted patients, and those are the ones that where I get into this topic in depth.
I'd love to hear as well, because I know just with the interviews I do here on this channel over the years, which are just a drop in the bucket compared to the people that you've spoken to, but I've definitely had some solid themes, almost, as they smack me in the face, just things that keep coming up over and over. So from the 7,000 patients that you've talked to and interviewed, what are some of the key things that stand out around, not just about their condition, but the things that either held them back from alleviating those symptoms or the things that help them speed up that process and be more successful with that process?
Yeah, I would say if I had to pick one theme that was the most important, the single most important, I would say that it involves addressing the self-image that people acquire when they live through ACEs. And as I mentioned earlier, that self-image is often, that you're a second-rate human being, that you're not measuring up, that you're worthless, when in fact the opposite is the case. My patients who come through significant ACEs are analogous to having been parachuted into the Himalayas as a toddler. Through no fault of their own, they find themselves in this very harsh, difficult environment, and they have to somehow live through it, navigate through it, find their way out of it. And the fact that they have done that, to me, makes them heroic, because it takes tremendous perseverance to come through a lot of these environments. And I want my patients to recognize just how much they had to come through. And often that same exercise of imagining a child of your own having to do the same thing gives you a more accurate perspective on how much it really was that you had to deal with. And when people can truly see that accurately, then they can appreciate themselves for the heroic people they truly are. And that flip in self-image from negative to positive is absolutely key. It gives people a foundation for making all kinds of other changes that are going to help them not only with their symptoms, but in the way they live their lives.
So for your average person who is facing symptoms and navigating the conventional medical system and likely landing themselves into a physician's office who isn't aware of this, what is your advice for patients for how to approach their condition when not everyone might understand what's going on?
Well, you definitely need the physicians to reassure you that there's not an organ disease or structural damage going on. And once that process is done, then you can start to focus on these other considerations that I've been talking about. So when you go into a doctor's office, just right off the bat, but with a new symptom that's not been diagnosed and don't know what it is, there's a 40% chance that you have a neuroplastic symptom, because 40% of people that go to a primary care physician, that's what they have. And then if you get the diagnostic tests and they're negative, they're not showing an organ disease or structural damage, then you're probably at a 90% chance that you've got a neuroplastic symptom. If you've got a lot of psychosocial stresses in your life, past or present, that moves it up even more. If you've got multiple symptoms, if you've got symptoms that move from place to place, that moves it up even more. If you start working on addressing the stresses, either through going to symptomatic.me and using any of our many resources there, books and podcasts and courses and recorded conferences and all the things that we have there, and you begin to see improvement, that is still additional evidence and moves you ever closer to 100% certainty that a neuroplastic condition is what you have. And then the final proof is if the symptoms go away. If we are able to successfully and completely alleviate the symptoms through this approach, that proves the diagnosis.
So 40% of patients going into a doctor's office will have neuroplastic symptoms. In your estimate, what percentage of physicians would you say are trained to treat these symptoms?
Less than 1%. But the ones that learn this, they absolutely love it, because now you've got 40% of their practice that used to make them beat their heads against the wall or burn them out. Now all of a sudden they've got something positive that they can do. That they can actually turn these patients from a source of frustration for themselves and the patients too, of course, into something that's professionally very rewarding group to work with. One doctor who learned this approach took me aside at a conference and said these ideas had put the joy back into her work. And she was among 3 doctors that I taught in a medium-sized city on the East Coast, and the three of them working with a psychologist were so enthusiastic about this. It had transformed their practice to such a degree that they proceeded to teach 70 other doctors how to do this in the next year.
That is incredible. So I know you have a lot, you're involved in a lot. There are a lot of resources that you are a part of for people. I know one of them is ATNS. So can you tell us what that is and how can it help people with ME/CFS and long COVID, or perhaps other doctors who are looking to learn more?
Yeah, the Association for Treatment of Neuroplastic Symptoms was founded in 2011. By a group of volunteers, and we're still all volunteers. We're not doing this for the money. In fact, everything that I earn from this work is donated to the ATNS, and I work there without a salary. And our mission is to educate healthcare professionals, both mental health and medical, and the public about this condition. That this is more than almost double the size of the diabetic population, but almost nobody knows how to diagnose or treat it. And that to us is just appalling. So we've created a curated list of books. We've got courses on this, people who support us by becoming members so that we can get the word out to a larger number of people. We'll have access to a self-treatment course that we created, monthly Q&As by Zoom that are international. We have people from all over the world that attend those and can ask questions of experts. We have a new podcast called The Story Behind the Symptoms, where I interview patients much as I did in my office to uncover the underlying issues. So lots and lots of resources there that people can use to get better.
And I know you have an excellent book as well called They Can't Find Anything Wrong. So what can people expect from that book?
That one has 4 dozen stories in it from my practice that illustrate the spectrum of different kinds of stresses that are capable of making people physically ill, and gives advice on what to do for each of those different kinds of stresses so that you can get better. But yeah, there's 4 dozen that are selected out of all the thousands that I've interviewed over the years. We also have 2 textbooks, but they're written without jargon. The first one, in fact, it uses the older term psychophysiologic disorders, and I co-edited it with 3 other people. But for people who are interested in the science of this, it's a very interesting read, and I know a lot of psychotherapists who work in this field are prescribing that book for their patients. So that's another resource.
And of course, this will all be linked in the description. So if people watching, listening, expand that, and you'll find everything that Dr. Clarke has talked about there. Incredible that there are so many free resources available for people and so much information. So even if you don't land yourself in that 1% of doctors' offices who are in the know, it doesn't mean that there isn't help for you. There are so many ways to access that information and the recovery and the treatment options that you need.
There's a lot of hope because these things work. It's fascinating to me that so many healthcare professionals from so many different branches of the system have found their way to this work. We all have different professional training, different personal backgrounds, different kinds of patients that we treat, and yet people from all over the world have just kind of converged on a fairly small, consistent set of principles that we use to diagnose and treat this condition. Because it works.
I know you're also on the advisory board for the Curable app, which so many people I've interviewed have mentioned that they used it for their recovery from ME/CFS or long COVID, even though it was initially designed specifically for chronic pain. So can you tell us about your work there and just a little bit about what Curable does?
Yeah, I was fortunate to meet one of the founders of the Curable company right when they were first getting started, and we had some wonderful conversations at a Starbucks in Denver. Basically every other month for quite some time. And I shared with him as much of my experience as I could. I gave him names of other people, and he got others on his advisory board that are every bit as experienced as I am. And the genius of it is he took all of our best ideas and his programmer put them into this tremendous user interface. And they've recently expanded their offerings just in the last couple of months of what they're doing. And the amount that they charge is, on the order of a half hour of psychotherapy. So it's one of the best values out there.
Yeah, they have a great podcast as well. And I do have a link that gives people 6 weeks of Curable for free. So I can put that in the video description if people want to check it out, because you can learn a lot in 6 weeks. So if people want to learn more from you, if they want to see everything that you have available, is the ATNS website the best place to start?
Yeah, symptomatic.me. A couple of resources I neglected to mention. One of them is our 12-question quiz. I spent a lot of time on every word of that quiz to boil it down to the essentials for screening people for the kinds of issues that can lead to neuroplastic symptoms. So the more questions to which you answer yes, the more likely it is that your physical symptoms have a neuroplastic cause. We've also got this wonderful 7-minute video that shows some of the scientists that have researched this condition, some of the clinicians that have put these principles into practice, and some of the patients who have had life-changing benefits from it, all in 7 minutes. So it's something that I know your viewers would enjoy.
Incredible. Again, all of this will be linked. I'm going to link here to the interview I did with Dr. Howard Schubiner that you mentioned. So if people watching, listening, if this is resonating, this is another information-packed interview. Definitely not to miss.
He's brilliant.
Oh, Dr. Clarke, I could keep you here all day, but I will use some self-control and just say thank you. Thank you so much. Every word of this has been so insightful. We are so fortunate to have your decades of vast experience and research and insight into this condition. So just really appreciate you, the work you're doing, and the impact that you're having on so many people's lives. So, and thank you for being here today.
Thank you, Raelan. I really appreciate how you are moving this forward and bringing this information to so many people.
It is absolutely my pleasure. So yeah, thank you again for being here. Thank you to everyone who's watching, listening, and I hope to see you in this next interview with Dr. Howard Schubiner.